So here we go. Sorry, my computer went weird. Finishing up the female reproductive system. So let's do that. Diseases and conditions. Now, just like with every organ system, there are diseases and conditions of the female reproductive system that revolve either around the baby or the fetus itself inside the body or the female itself. But I do want to caution you, take it all with a grain of salt. There are 7.6 some odd billion people on this planet. So while bad things can happen, they very rarely do. But you can have abruptio placentae, which sounds like a magic trick instead of what it actually is. What it actually is kind of devastating. It is the premature disruption and detachment of the placenta off the uterine wall. The placenta is how the baby gets all of its oxygen and nutrients. And so when the placenta is no longer attached, the baby is no longer getting anything. Now you can catch it fast enough that you can keep the baby alive through cesarean section, depending on what stage of labor or pregnancy you're at. If it's before 24 weeks, it's basically nobody's going to the baby will not live. But it's after 24 weeks, there's a chance if you get the baby out quick enough. If you don't, the baby will die, and then it'll be a stillbirth situation. The cervical dysplasia. Dysplasia is the abnormal presentation of cells on the cervix. So this is typically due to the human papillomavirus, which is why I really encourage you to get the HPV vaccine before you ever start to have sex ever in your life. I think I mentioned before, maybe not to you guys, that nobody cares if you get HPV. That's not the issue. HPV causes cervical cancer, and that is a very hard cancer to diagnose and treat in time before it can kill the female. So the whole point of the HPV vaccine is to stop the cervical cancer that has been killing many females on the planet. The dysplasia, just abnormal cell changes on the surface of the placenta. You catch it during a pap smear, and we'll talk about that in a few slides. Ectopic pregnancy is when the fertilized egg does not implant in the right place. So this picture is showing a fertilized egg that has implanted in the fallopian tube. Usually, you have to terminate this pregnancy. There's no way to move the baby and keep it alive, but also if you keep it where it is, it will rupture the fallopian tube and it can kill the mother. So now both mom and baby are dead, when that's not a good thing. You have to, so ek means outside the surface or outside the area pregnancy. It's not a good thing. Endometriosis has to do with the interior lining of the uterus, the endometrium, right? And endometriosis is a condition in which that endometrial tissue starts developing outside of the uterus where it doesn't belong. It's not supposed to be outside, it's the inside lining. And it can go throughout the entire pelvis and the abdominal wall. It causes pelvic pain and cramping and sometimes infertility. It can also lead to endometrial cancer, which is cancer of the endometrial lining as well. Mastalgia is pain of the breast. Could be caused for no reason, could be conditions for concern. The breast is tissue and it can be damaged and cause pain. It can be inflamed and swollen and be painful. But then sometimes it means you need to go get it checked out. Menorrhagia is excessive flow during your period, during menstruation. So if you are a heavy period person and you are heavy for all 7 days, or you go beyond 7 days and you're still heavy, you are experiencing menorrhagia. And that's not normal. You should not be bleeding that heavily for that long. It'll definitely lead to anemia. So you need to be talking to your physicians about ways to control that. And we'll probably just put you on birth control to try to regulate the period. Polycystic ovarian syndrome is a hormonal disorder. characterized by abnormal menstrual cycles, excessive facial or body hair because your hormones are out of whack, and numerous tiny cysts in the ovaries. It can lead to infertility, but it's not necessarily going to do that. It is difficult to control. It's difficult to regulate those hormones. Birth control and other treatments will be done. Preeclampsia is also known as toxemia, which is what it was called way back when, and then we finally called it preeclampsia. It is characterized by high blood pressure, headaches, too much protein in the urine, and swelling of the lower extremities. But if you've been reading pregnancy books like I have, it is sudden swelling, like not normal swelling that has been gradually building up, but it's sudden swelling of the feet and the face with the hypertension. Hypertension is obviously not good at any time, but at this time it can cause the mom to stroke out. And if it left untreated, it can cause seizures and death of the mother. Premenstrual syndrome is PMS. Now, PMS is irritability, moodiness, tenderness, all around the time that you are going to start your period. It is a normal it's caused by the hormonal changes in your body so that your period can start, because your body has to go, I'm going to have a baby, have a baby, have a baby. Nope, whoops, now we need to have a period. And so the hormones change, and that change in hormones, messes with us. But there is the condition of severe PMS, which does need to be discussed with your physician. And once again, they'll probably put you on birth control to try to regulate your hormones. Pseudocyesis is very interesting. Pseudocyesis is a psychosomatic condition. So it's your brain influencing your body. It is the condition of experiencing a false pregnancy. So the woman is so convinced she is pregnant, her body will actually go through hormonal changes and show some of the symptoms of pregnancy. But there is no pregnancy. There is no baby. It's all in her head. So that's really interesting. A rectocele is when the rectum behind the uterus, it's also known as rectal prolapse. So when the rectum, something happens to the tissues that hold the rectum in place and it starts to try to protrude or expand against the back of the uterus. It's a rectocele. And then vaginitis. Vaginitis is inflammation of the vagina. It can be caused by anything, really. It can be caused because you've changed the type of underwear you wear, because you change the type of detergent that you use on your clothes. It can be because of, sexually transmitted diseases, yeast. You can have a yeast infection. You can have a bacterial infection. These are all typically due to hormone imbalances. And then you can have, so what's going to happen is your vagina is irritated. It'll probably be itchy. There's unusual vaginal discharge and bleeding that has nothing to do with you menstruating. You'll know if something's wrong with your vagina, is what I'm saying, because of vaginitis. Okay, let's define each disease or condition. Metrorrhagia, so bursting forth of the period from the uterus. So it's irregular or excessive bleeding during or between menstruation. Definitely between menstruation, totally not normal. We need to talk to our doctor. But if you have just like really super heavy periods, there's ways to alleviate that. It's your hormones in overdrive is what it is. And we gotta be like, remember, calm down, hormones. Remember, the endocrine system is what's controlling all of us all the time. And so sometimes we need to help the endocrine system be like, hey, too much. Let's go back to a homeostasis situation. Pyosalpinx. Salpinx is salpinx, fallopian tube, and pyo is, you should know this by now, but pus. So pus in the fallopian tubes. Not normal. Something's going on. We need to get that figured out. Oh, diagnostic tests and procedures. Okay, so there are lots of genetic conditions on this planet that babies can be born with. And you can determine very early in your pregnancy if your baby has one of these genetic conditions, if you suspect that you are a carrier for them or have a history in your family of having them. One of the ways we can do this is through amniocentesis. Now, if you see this picture here, what amniocentesis is inserting a needle through the abdomen into the uterus, hopefully not hitting the baby, which can happen, and getting some of the amniotic fluid to test, because it's going to be full of the baby's cells, to test for genetic disorders. Comes with risks, like everything, could cause 1 to 2% of the time will cause spontaneous abortion. Could also hit the baby with that needle and damage, not damage the baby, but that's unnecessary. The baby doesn't need to be poked with the needle. A cervical biopsy, if you show cervical dysplasia in a pap smear, which we will once again talk about in a second, then the next step will be to go in and do a surgical biopsy, which is to remove tissue from the cervix. You need to do a colposcopy, so these two go hand in hand, to be able to do that. And so this picture down here, it's smaller. Sorry, I just tried to put it on the slide so you could have some visual. It's also in your textbook, which you should be reading. This is a speculum. This piece of instrument is called a speculum, and the speculum holds the vagina open so that the doctor can easily access the cervix. And so the speculum and the light, the colposcopy, will be used in order to get a piece of the cervix for the cervical biopsy. Hysterosalpingography. We're doing a recording, we're imaging, we're recording specifically the structures of the uterus, hystero, and the fallopian tubes, salpingo. A fluorescent dye is introduced into those organs. Why can't I remember easy words? And it's usually used to diagnose a blockage of the fallopian tubes. Now, Pap test or Pap smear. Pap was a person's name who invented this procedure. And pelvic examination. Ladies, before you ever go and have sex, you need to have a Pap test and a pelvic examination done so that you have a normal baseline of yourself in case of STDs or cervical dysplasia or human papillomavirus or some alteration to your human body. Another reason why we wouldn't typically have a hymen intact is because of pelvic examinations. Now, depending on cultures, this may or may not be allowed. That's fine, okay. But then as soon as you are sexually active, you need to go to the doctor and have both these procedures done. And then the Pap test you'll have done yearly for 3 or 5 years. They keep changing the rules. And then once you have had a negative Pap test for that amount of time, then they'll switch it to every 3 years if you are with the same sexual partner each time. If you are in a stage of life where you're having multiple sexual partners, then you'll have a Pap test every year. But once again, here's our friend, the speculum. He's not a friend, but he's not a foe either. They're doing this to make us healthy. And the Pap test is a swab. It actually is not. It's more of a plastic brush that they insert. You can't touch the vaginal walls because then you'll contaminate it with the cells of the vagina. They insert it and touch only the cervix, and they roll around the outside of the cervix and collect as many cells on the end of this brush as they can. And then they send that off to the lab to check to make sure your cells look normal. After that is done, during the same examination, they'll do a pelvic examination. This is inserting a few fingers into the vagina because that's the only way to feel the ovaries. And so they'll press down on the abdomen while pressing up with their fingers to feel if the ovaries feel like they are in the correct place and are the correct size. And so they're not pleasant tests. They're rather invasive, but they need to be done to make sure that you are healthy. And then a pregnancy test, of course, is what you classically see in movies where you pee on a stick, right? What this is doing is this is testing for the human chorionic gonadotropin, or for short, HCG hormone, which is present in pregnancies. And if the strip turns positive, then you go to the doctor and they might just do another urine strip, or they might do a blood test to confirm, but then pregnant. Identify each diagnostic test or procedure. Coldoscopy. Remember, coldo is that cul-de-sac word and scopy is viewing. So we're viewing the internal organs of the female pelvic cavity. And a mammography is something all females will be asked to start doing. I think it starts in our 40s. I'm not there yet. I haven't been asked to have one, but it is the recording of the breast tissue. And so it's a machine. So your breasts are going to be placed on a plate, not a plate, but like a surface. And then the machine will come down and actually, it's kind of going to squish the boob so it can get it as flat as possible, so it can view as much of the tissue as possible. And it takes an x-ray of that to see if you have any malformations in the breast tissue. Surgical procedures and therapeutics, we have colpography. Raphy is to suture. Colpal is the vagina. So to suture the vagina, which can get damaged and could need suturing. Typically, through birth, not like any kind of trauma, hopefully. And episiotomy. Remember, episio means the vulva, and otomy means to surgically cut. This is a procedure that is thankfully being performed less and less, but not completely. But what happens in an episiotomy, it is something that occurs during birth, where the doctors, typically without consent, will cut the tissue of the vagina to make it larger so the baby can come through faster. There is not good evidence that this is a good practice, and in fact, it typically results in more damage to the female body than there would have been if it didn't happen. So just remember that for your future. Mastectomy is removal of the breast, typically due to breast cancer diagnosis. We're going to find lumpectomy and mammoplasty. A lumpectomy, the breast tissue can get breast cancer. We know that. But other things can cause like cysts to form or random lumps in the tissue. And so a lumpectomy is a surgical removal of that lump. Now you can have lumps in other part of your body that need to be removed as well, but in this case, it's referring to breast tissue. And then mammoplasty is surgical repair of the breast or getting the fake boobies put in, which can happen after a mastectomy so that you don't feel like you're missing a part of yourself, or it can happen for personal reasons. Therapeutic drug treatments. An abortifacient or abortifacient is something that's going to cause an abortion. A fertility drug is medication that stimulates ovulation, so it puts your ovaries into hyperovulation, so you'll not just ovulate the one egg a month, but multiple eggs a month to increase the chances that one of them is fertilized. So this is people who want to be pregnant, take fertility drugs. Hormone replacement therapy. There's a lot of disorders that happen in the female body where our estrogen is too low. And so these are drugs that replace hormones that are normally secreted by the ovaries, typically during menopause or after we have hysterectomies, when our uterus and ovaries are removed for medical reasons or because we don't want to have babies anymore. Oral contraceptive pills are birth control pills. Medication. So what they do is they change the way your hormones talk to your body, and they make sure your ovaries do not ovulate. If you don't ovulate, there's no way to get pregnant. There's nothing for the sperm to fertilize. And that's how birth control pills work. And then oxytocin is the hormone of love. But for some reason, sometimes you need oxytocin. And in fact, if you are ever going to be induced into labor when you're pregnant, what they're doing is giving you a synthetic version of oxytocin to cause that labor to commence. So, common abbreviations: AB is abortion, certified nurse midwife is actually who I'm seeing. I'm not going to an OBGYN. I have a certified nurse midwife. D and C is dilation and curettage. Dilation to get the cervix to dilate, and then a curettage is a machine that goes in and removes tissue from the uterus. That HCG is that human chorionic gonadotropin, which is what pregnancy tests test for. Para-1 is going to be your first live birth delivery. So for people who struggle with miscarriages and stillbirths, they might have multiple pregnancies before they get to para-1, or some people have just a normal first pregnancy. And then pelvic inflammatory disease. When we talk about STDs next year in health science theory, we are going to find out that every STD that you get can lead to pelvic inflammatory disease, which can cause scarring up and down your entire uterus, fallopian tubes, and then it causes infertility. The following meanings: PAP. Oh, this is the pap smear. That's the guy's full name, Papanicola, whatever, pap smear. That's the pap smear test we talked about. PMS is premenstrual syndrome, and TSS is toxic shock syndrome, which occurs from not, historically it happened because women, when tampons were first introduced on the market for women, because let me be clear, tampons were first created to plug bullet wounds during World War II. During World War I, sorry. And when there was no more war, the people who had developed tampons were like, we have this product we need to sell. And they were like, hey, women bleed. So that's how tampons became a thing for menstrual care. But when tampons were first introduced on the market, they were made fully of cotton, and there was no time limit on anything that said how long you keep a tampon inserted in the vagina. So women, because they didn't know and weren't really thinking, kept the tampons in for 5 to 8 days for their entire periods. You have bacteria in your vagina that's normally there. It's part of your normal flora. But if you give them a place to live, like a tampon, they're going to explode in population. And one of those is Staphylococcus aureus, which is a normal skin flora. We have it everywhere. But if it can, it will kill you. And one of the ways it will kill you is by releasing a whole bunch of toxins into your body. And so these women were dying from toxic shock syndrome from having the tampons in their bodies for so long that the bacteria, the Staph aureus, could colonize the tampon and release so much toxin into the human body. Which is now why on every tampon box, if you read the fine print, it says no single tampon should ever be left in the body for more than 8 hours. 8 hours max. Max is the max. That's the one. So if you do get around to using tampons, or you already do use them, make sure you really pay attention to that clock for this reason. Okay, that is the end of the female reproductive system. That is the end of your medical terminology textbook. Good job. You did it. I'm proud of you. Thank you so much.